Hello, my name is Pauline RN. Welcome to my channel. The title of my video today is on nutrition, questions and answers taken directly from RN NCLEX examinations. Before I get started, please hit the like button, please subscribe, and please share this video. My first question, what are your first class proteins? Correct answer, complete protein. Animal foods, meat, fish, dairy, eggs, peas, beans is the correct answer. Next question, who are your anorexia patients? Correct answer, these are your patients who starve themselves. They are obsessed about their weight. Next question, who are your bulimic patients? Correct answer, they self-induced vomiting, binge eating, obsessed with weights. Monitor these patients 2 full hours after eating. Their intention is go to the bathroom and induce vomiting. Next question, what will be your assessments for patients who have been administered Lasix IV or oral? You would correct answer, Lasix is a water pill. Maybe your patients, they have edema, but they will be urinating frequently. Our assessment will monitor their potassium levels. If their potassium levels become low, we notify the doctor to have the potassium replaced orally or IV. Patients are having frequent diarrhea. What would be your assessments? Correct answer, you'd monitor the patient's potassium level. If the patient is having frequent loose stools, we will notify the doctor. If the potassium level is low, it will be replaced IV or oral. What would be your teaching for patients with stomach ulcers? We'll teach them to eat small, frequent meals. Small, frequent meals is the correct answer. Patient who is on NG tube, what would be the diet for these patients? The correct answer, the patients would be on NPO, nothing by mouth. Oral care okay, do not swallow the water. Head of bed is elevated 90 degrees, prevent aspiration. Your patients are on NG tube feeding. NG tube feeding. What would be your assessments and interventions for these patients with NG tube feeding? The correct answer, these patients would be NPO, nothing to swallow. Mouth care is okay. Patients with NG tube, indication would be for malnutrition, abdominal obstruction, resting the guts. These patients with NG tube feeding would be on parental nutrition. NG tube feeding, they would be on parental nutrition. Patients who are on G-tube, a gastrostomy tube that's in their abdomen, they also would be NPO. We will have to give them their oral care. Head of bed will be elevated 90 degrees, prevent aspiration. When patient when an NG tube is inserted, it is confirmed. Placement of an NG tube is confirmed only by X-ray. That's a test question. NG tube, GI tube, gastrostomy tube, they should be flushed every 4 hours with water as ordered by the doctor to prevent them from clogging. Next question. What would be your assessments for your patient with G-tube, a gastrostomy tube? That's the one in the abdomen. We should assess their tolerance to the tube feeding. Note if they're having abdominal pain. Note if they're having bloating in their abdomen. We should check their residuals every 4 hours as ordered by the doctor. We should check for bloating. If they have, check for abdominal distension. Check for abdominal distension. If they are having any of these indications, turn the tube feeding off and notify the doctor. If you check the residual from the tube feeding and it's a lot, it's more than what the rate is infusing at, turn the tube feeding off, notify the doctor. When you're inserting an NG tube into your patient's nostril, how do you do the measurement? The correct answer, the patient should be in a high Fowler position, 90 degrees high Fowler. The measurement will be done from the tip of the nose to the xiphoid process. From the tip of the nose to the ear, then to the xiphoid process. Next question. How many glasses of water is ordered by the doctor for intake daily? And the correct answer, all should have 6 to 8 glasses of water fluids daily is the correct amount. Next question. Patients with low albumin. You check your labs, the albumin is low. These patients are at risk for malnutrition. The doctor will order a TPN, parenteral nutrition for malnutrition. If patient's albumin is low, the doctor also can order IV albumin is needed for low albumin. For malnutrition, they'll order parenteral nutrition for malnutrition. Low albumin can lead to malnutrition, so the doctor will order a parenteral nutrition, TPN, parenteral nutrition, which is administered IV. Low albumin is replaced by albumin IV. Okay, next question. What is the best indicator of nutritional states? And the correct answer is a lab test. It's a blood draw. You draw the patient's blood and send it to the lab. Best indicator of nutritional states is serum proteins, albumin, transferrin, retinol binding proteins. These are best indicator of nutritional states. These are lab tests, blood draw will send to the labs. What is TPN definition? Is total parental nutrition for malnutrition. It is given IV through a central line. What are our tests to measure proteins and albumin? Our test, the correct answer, our test to measure protein and albumin is a blood test. It's a serum albumin transferrin level, total serum protein test. These are all blood tests. Serum albumin, transferrin level will draw, and we'll monitor these tests to measure our protein and albumin level in our patients. What's another method to measure albumin level? What's another method to measure albumin level? And the correct answer, we can do a 24-hour urine specimen test, which is kept on ice for 24 hours. We keep changing the ice water. It has to be kept on ice for 24 hours, and the doctor wants to measure the amount of albumin in 24 hours. Now, the kidney filters proteins from your body and absorbs it. So your albumin level can be measured by a 24-hour urine specimen, and also a protein albumin test can be measured by source of a blood test. Please hit the like button. Please subscribe. Please share this video. Thanks for watching. Stay tuned to part 4, which is the last part of nutrition. But there's a lot of nutrition in State Board. I did get a lot of nutrition, but nutrition was so easy for me. So thank you. Have a good day.